Gauteng's COVID-19 Command Council answered questions today as the number of coronavirus infections is surging in that province. The province saying that its hospitals are buckling under the pressure from COVID-19 as the virus is spreading across the country. Zikhona Tshona was at that briefing. She joins us now. Zikhona, good afternoon to you. I mean, anyone who's been awake over the last 48 hours will know about what's happening at Steve Biko Hospital. But Gauteng provincial government, what plans do they have in place?
So what they're going to do now to take this matter forward, you'll remember the images that came out of Steve Biko were of people sleeping in tents and you could visibly see the oxygen tanks next to them. So what David Makhura has said now is that they're going to open up Nasrec. They had shrunk it. They opened it up at the start of the pandemic, then shrunk the number of beds that are available at Nasrec to 500 for critically ill patients and 500 for general patients that have just gone there for quarantine. So now what he said today is that they're going to open up and have 1,000 beds for critical patients at Nasrec. So that's one way that they're trying to increase the number of beds available in the province, because they have raised very importantly that the numbers are raising quite fast. Gauteng is now at about 6,000 daily infections. Since about the 12th of December this year. On the 8th of January this year, they actually hit 6,900 daily infections. So that is quite a concern, given the fact that many people have not returned back from wherever they were for holidays to come to Gauteng to work or to do school. So he has raised that as a concern, that when people do return to Gauteng, they are expecting the worst.
I mean, we know that number of cases are going. I mean, what happens in Gauteng almost determines what happens in the country. It's one thing to increase beds at Nasrec, it's another to increase beds at Steve Biko, but medical staff and then crucially oxygen is what's needed as well.
So what they're going to do with medical staff, I know that Bara did accept people, new employees at the end of last year, around the 29th of December. They were receiving new staff. What they're going to do is also extend the contracts of staff whose contracts were expected to be suspended from now going forward. And they are going to be taking in people as time goes on, because he's saying it's a continuous program that they're running. Even with beds, they will be getting more beds as the country continues to fight this pandemic. Oxygen tanks as well. They're monitoring the people in ICU quite closely, because they need those beds to be available as more people come into hospitals to receive care. What is important that came out of yesterday's visit by David Makhura to Steve Biko Hospital is the fact that people are actually referring themselves to hospital for care, and in large groups, not just myself as Zikhona going to refer myself to a hospital and saying I am in trouble, but in large groups, and not just from Gauteng, from provinces such as Limpopo, the Northwest, as well as Mpumalanga. So they're saying the pressure on the province is not just out of the people that are living in the province, but also the neighboring provinces are also coming to Gauteng for medical care. You'll know that this is the most populated province in the country. 1 in 4 South Africans live in Gauteng. So you can imagine when people do come in, it's going to be a bad situation.
So we have all of this happening at the same time. I mean, how worried is the Premier? I mean, does he believe the province is going to get through this? There have been some accusations. I think it was the South African Medical Association yesterday who told Newsroom Africa that this was a disaster because the Gauteng provincial government hadn't properly planned.
Look, the Premier can only say so much, and he can only try and make it seems as though the province is ready. He is concerned. He did use words such as, we are preparing for the worst because we'd rather be prepared for the worst than not be prepared at all. For example, in the city of Tshwane, which is now the hotspot in terms of the number of daily infections that are rising in that area, he said that's where the heat is at the moment. So you can gather from his language that they are concerned, but they do have scientists and data capturers that are helping them trace the patterns in the province and also try and see which areas are people not complying with the COVID-19 lockdown regulations, particularly in the city of Tshwane. That area, he's basically said it's a mess there, particularly also in the congested areas, Soshanguve, Mamelodi, in the city of Johannesburg, Alexandra Township, Hillbrow, Yeoville, in Ekurhuleni, it's Tembisa. So those areas are of huge concern. And you'll know that with people from those areas having gone out of the province and they'll be coming back, and people in Gauteng live very closely together, and they share basic services such as toilets, such as taps. So it's going to be very hard for them to stay at home and isolate and observe the regulations that we need to observe to make sure that we don't spread the virus.
Okay, I mean, there's an awful lot going on around Gauteng at the moment. Are there any predictions being given by government around how they expect the pandemic to move through Gauteng? I mean, are they expecting it to continue in this way for another 2 weeks? Are they expecting maybe, hopefully, some sort of decline? Are they expecting it to get worse?
So what they did mention is that it was a good thing for the president to implement stage 3 at the time that he did in December, because had he not, the numbers would have been rising more rapidly than what we're seeing now. So the prediction is that without the level 3 implementation, Gauteng would have reached probably 85,000 infections by now. But now that the level 3, the president announced yesterday that it continues until the 15th of February, they're expecting that the numbers will rise because of the people that are coming in. But it's hard to predict now, because a lot of people had predicted that the president will lift some of the regulations, and as far as alcohol is concerned in particular. But now that he's kept that ban, it's very hard for them to predict how the patterns will go. But they're saying without these regulations, we could have actually seen a far worse picture than we are in Gauteng. I mean, we are sitting at the moment at 400 funerals per week. At the peak of level 1, which is around July, the number was at 200 funerals per day. So he's saying it's better now, but we are not at the peak of level 2 yet. We are expecting things to be far worse than they are.
Oh, all very sobering, isn't it? Zikhona Tshona, really do appreciate the time. Thanks very much indeed.